Vacation would have been terrifying in Florida because Florida's in full screw it mode.
I was in Florida, and I think it was October. No mask, nothing.
Yeah, they had masks. I mean, people sort of wore masks sometimes in some of the, but I was in a restaurant and, there were people sitting right next to each other at the bar and, and it was a low ceiling place. And, the NFL data is pretty compelling that the 6 feet thing doesn't really matter if you're inside in an unmasked situation. That's why they stopped doing team meals. We're ready? Okay. We're ready to get started. Time waits for no person. So it's hopefully those of you who are joining us from home. It's one of the best days ever in the academic years when we get to hear the chief resident give his or her grand rounds. Dr. Stone joined us as a resident from Drexel University, and then of course, was an excellent resident in the best internal medicine program in southeastern Tennessee, and really has been. We've had some good chief residents, but he's in the top of that cadre. So, going to talk to us today about vaccine hesitancy, and so you can give me a warm virtual welcome for Dr. Stone. Golf clap.
Thank you very much. Appreciate y'all that are here in person and everybody at home. Trust that you're here too. And there we go. Okay. So thank you, Dr. Lambiasi. Like you said, speaking about vaccine hesitancy today, financial disclosures. I'm the chief resident. I have no other vested interests. I have nothing to disclose. All right. So what are we talking about today? So vaccine hesitancy is an interesting topic, but it's also incredibly broad. So trying to focus in a little bit. So I'm going to be going over basically the basic definition of what we're talking about, give a brief historical overview of kind of how vaccines were developed and some of the responses along the way, really what the core components of vaccine hesitancy are, talk about some strategies, communication, things like that to overcome vaccine hesitancy. And then, the big thing, taking a look where we are right now, with COVID, because there's new data coming out literally every day as I was updating this talk as late as last night. Things we're not talking about today. So we're not doing deep dives on anti-vaccination groups. If a person is strongly against vaccinations, I don't have a magical way to convince you to get them to get a vaccine. Not going to be going over conspiracy theories or big things like that. And we also have to acknowledge that every person, every group that has some concerns with vaccine is different and has a different experience. And we just don't have the time to do deep dives on these in this short hour. So I'll try to acknowledge what I can, but there are a lot of things that we'll just have to kind of breeze by. All right, so vaccine hesitancy. What are we really talking about here? We hear a lot about it, about people being concerned about vaccines and being questionable. One thing to remember is that the vast majority of people get all their vaccines and just kind of go along with the schedules that are out and do all those things. And then there's a very small group that are completely against all vaccines. Sometimes it can feel like it's a lot of people. Studies show it's like 2 to 3% of the population are strongly against vaccinations. But what we're talking about are the people in the middle who accept some vaccines, have some questions, might go on a delayed schedule, and kind of what encompasses that. And this is a group that is very unique, and there's a million different groups that encompass this. And so there are three main things that kind of define vaccine hesitancy and make it important. So confidence, complacency, and convenience. Confidence, how do they feel? Is the vaccine safe? Do they have trust in the way that they're getting it? Do they think they need the vaccine? And can they get it? Is it affordable? Is it available? Do they know how to go? Do they have to go too far out of their normal day-to-day in order to get this? So taking a deep dive in on confidence. So confidence is not only the trust in the vaccine itself, but also the system that delivers it. Always with vaccines, a question comes up about side effects. Is it effective? All those things. Study after study have shown that, whatever the messaging, it doesn't really matter unless people at least believe this is a baseline, that it's safe and effective. And that's not just in the vaccine, but it's also in the care team that's giving it. It's an institution that's providing it. It's knowing that they're getting what they think they're getting. And so there's, the Vaccine Conference Project is one looking to just, specifically track data about this and, help improve confidence in vaccines globally. Complacency. I always have to take a second with complacency because it just is a little bit backwards in my mind. It's basically the idea of, are the risks, do I really need to go get this vaccine? Are the risks of these vaccine preventable diseases low? And vaccination really deemed not a preventative action. Again, this is very vaccine specific. Something like polio, this really wasn't an issue because people were terrified of it and wanted to get it. It's one of the reasons we were able to eradicate that. We get with, COVID, we get with measles. It's this question of, all right, is it really needed, or am I going to be fine just being healthy? And then also the self-efficacy, how the own person's beliefs and how they feel that they can control their own health and take things in their own hands outside of it. And then the last one is a big thing that we run into a lot, and we'll kind of address all these again later, is the convenience of getting the vaccine. Is it available? Can I afford it? Do I know where to go to get it? Is it available easily for me? Do I have to drive hours and hours and take a day off of work to go get this vaccine? I'm probably not going to go do it. They also have to understand it. We run into this with language barriers and talking with different populations. Unless they understand really what they're getting and the importance of it, we're not going to get anywhere. So those are the big defining parameters of of vaccine hesitancy. This is really just to let you know, this is a rapidly expanding field. This is just looking at 2007 to 2012. I can tell you from doing all the research for this presentation that there are way more papers in this that were published just in the last 2 months. A lot of my sources are from 2021 because there's just more and more research going to this and looking into kind of why people are concerned about vaccines and what questions they have. So talked about some of the basics of it, but why does it matter? So it was actually named in 2019 one of the top 10 threats to global health. Current estimates that somewhere around 2 to 3 million deaths are prevented every year by vaccines. But if we had improved coverage, we could get up to another 1.5 million deaths to prevent it every year. And a lot of these go back to those 3 C's. There's a study that said that I think 1 out of 5 people in Africa even have the availability of the vaccines that they need to get. So this isn't just convincing people, this is also making sure that they're provided and well. And then also, again, acknowledging we're not talking about people who are just refusing everything. This encompasses people who are delaying vaccines for concerns. So studies that have shown that the pediatric vaccine schedule has tripled in the past however many years. There's more and more vaccines coming out, and every time there's more questions. And there's a study that showed in Oregon that the rates of these delayed schedules of I really need all these when you say it, they quadrupled within 3 years, pretty recently. And one of the issues that we keep running into is that really vaccines are kind of a victim of their own success. A vaccine that works well and prevents deaths is hard to really market because the person who got it doesn't really see any improvement besides, they didn't get sick, they didn't get better, they just kept living their normal life. And so this just kind of shows kind of the ideal, or one of the ideas of how this normally works, and how once it gets really covered, you get that change in the complacency where, okay, this isn't really something that I'm too concerned about. Do I need to go get it? Rates drop, and then we start to have outbreaks. So to really talk about vaccine hesitancy, this is something that's been going on since vaccines have been around. So I wanted to take a second or two and just kind of talk about when vaccines started. So before vaccination, there was inoculation. So it started with smallpox, and this has been around since 400 BC. It's been known that basically people who had survived from smallpox were then immune to it. People who had smallpox and served as nurses for those who had the affliction. And there's multiple sources saying it's been before the 18th century. It was in the Turkish and Ottoman Empire in the 1600s. Voltaire wrote about it in the 1700s. And what prompted the Circassians to introduce this custom, which seems so strange to others, is a motive to all: maternal love and self-interest. This has been going on for a long time. And one of the studies I saw said that it still was 2 to 3% of people who were inoculated either died, were sources of another epidemic, had these things, but overall it decreased the case fatality by 10 times compared to actually getting the regular disease. So this has been going around for a long time. Does this name mean anything to y'all? Or do any of you guys know who this is? So this is Edward Jenner. He's basically kind of called the discoverer, creator, whatever you want to call it, of vaccination. He was born 1749, died in 1823. And he was somebody who was inoculated. It was called variolation then, smallpox, variola, variolation. And he described this horrible procedure that he went through of 6 weeks of having a bland diet, getting medications, being put up in an inoculation stable or stall. and it just had a horrible experience with it. So that was him as a child. You know, he had that experience, ended up doing medical training. And while he was in his medical training, he ran into his milkmaid when he was asking about smallpox. He said this, and this idea started changing some of his thoughts, realizing that cowpox was a thing that wasn't deadly, didn't leave these horrible scars, but it was also believed by some populations that it prevented smallpox and could be used. So he tested it. You know, he had so he, you know, found an 8-year-old boy, which again, all these things kind of rely on testing it on some populations that are very questionable. But so he took a patient, the photos right there, who had cowpox, basically took a little bit of the pus, the, you know, disease material, whatever you want to call it, and inoculated the boy with this. You know, he was a little sick for about a week, got better. About 6 weeks later, he took somebody who had smallpox and did the exact same thing, took a little bit of that disease material and inoculated them. The boy didn't get sick at all. And so he published these findings. He tried to find somebody to publish them, couldn't find it, ended up self-publishing it, and reactions were kind of mixed. But over the next couple of years, he kept doing this, expanded more, again, using some very questionable patient populations. And the practice expanded to 10 European countries. It made its way to Thomas Jefferson through a couple of contacts and actually led to the institution of the National Vaccination Program in the US. So that's kind of like the original vaccine. And the reason why we talk about that is because basically immediately there started to be pushback on this idea, especially when it started becoming mandated. You know, this is not a new idea. You know, most of the things we think about, because a lot of vaccines have been developed recently, we think it's a new issue. This has been going on since vaccinations have been around. So one thing I want to talk about, the big case that kept coming up in the United States, I really hadn't heard much about, but actually has had a lot of impact in our culture since then, Jacobson v Massachusetts. This was in 1905, it was a Supreme Court case. Again, 11 states in the US had mandated smallpox vaccination programs, you know, because of epidemic going on at the time. You could refuse it, but it included a $5 fine. He viewed this as being, you know, this was a person who had had a horrible experience with vaccinations as a child, and didn't want to have him or his children be vaccinated, and thought that this was unjust, arbitrary, all these things. And it made its way to the Supreme Court over a $5 fine. Current dollars, that's about $150 now. So we're talking about a horrible parking ticket, a speeding ticket, something like that, making its way to the Supreme Court. But it was this question about the 14th Amendment, which keeps coming up. But basically, you know, every person is guaranteed life, liberty, all those things. Is this taking away from personal liberty? Supreme Court decided no, that it's not that you don't have an unlimited right to personal liberty if it affects public health. And there were basically 4 tenets that things had to hit in order to be able to take away personal liberties. Had to be deemed a necessity. This couldn't be something that was just done for no reason. There had to be a true threat, had to be reasonable means, had to be affordable, available, you know, all those things. To be proportional, the idea of proportionality being basically that the risks, or sorry, the benefits outweigh the risks. And it's something that, and also avoiding harm. We're not doing things to inflict harm on people. And that case, we'll talk about it in a second, but comes up and even came up again this last year. We talked about smallpox in depth. This is just a brief overview of, you know, some more vaccines that came up, and basically every time that vaccines came out, there started to be pushback against them. A lot of times it has to do with mandatory programs being a cause for why people tend to push back on them. But this is not a new issue, and this has gone over and over again. Like I said, we're not going to go deep dive on any of these things, but, you know, most of us are familiar with a lot of these. Some of them were new to me, where I didn't really know some of the data behind them and why there were pushbacks on them. That was my brief little tangent on kind of the historical overview of this stuff. Again, when you're looking at a topic like this, it's easy to go on deep dives. That was one that I found interesting, and I think it sets it up well to go. But remember who we're talking about. We're not talking about the people who are strongly against all vaccines. We're talking about these people who have some questions, have some concerns, want to know a little bit more. So again, who are these people? Who are we talking about? It's not a single group of people. It has no political affiliation, has no age, sex, gender, race. There are many, many, many reasons why a person finds themselves in this group. And it's difficult to kind of tack down. One study I found that was interesting looked at this idea of moral foundations theory, that basically you have to look at a person's personal identity and things that they value. They identified 6 kind of broad overviews of care, fairness, loyalty, authority, purity, liberty. And basically people who were tended to be more vaccine hesitant and fall in that fell into sort of two camps. They either highly valued this idea of purity or sanctity. My body is a temple. As long as I'm healthy, I want all natural, I don't want chemicals, some sort of belief in that fell into this purity idea versus this liberty idea of this is my choice. This is my body. I am a unique person. You can't tell me what to do and make me do something that I don't want to do unless there's a really good reason why. I should be able to have the choice. Those tend to be the kind of two camps that people fell into, which is reflecting this idea of kind of the natural fallacy versus personal autonomy. And it's a constant issue that we run into. Individual liberties is the thing that kind of keeps coming up over and over again, and especially because most of our talk is going to be talking about United States population. It's one of the most commonly cited things. And again, for the most part, pushback comes when we mandate things. So this is actually from the ruling in Jacobson V Massachusetts, and it gets cited over and over again. In 1920s, when they were instituting mandated vaccines for school children, this was cited as the reason why you could hold children away from school if they weren't vaccinated. This came up in 2019 in the measles outbreak. They restricted some of these laws, and there was pushback, and it was, no, you can require vaccines for public safety. This has popped up again and again. This popped up for face masks. I honestly had forgotten that Texas had, regulated halting abortion clinics at times. They viewed it at that time and not a medical necessity, and the risks outweighed the benefits. And this got used to uphold that as well until some public outcry had them ease up on those. And again, why is it important and why are we talking about this? Personal liberty is great, but there are consequences to it when there are populations, and it doesn't take very much to push it. This is the rate of measles cases in the last decade, and there's kind of two big spots you see. 2014, 2015, there was the outbreak at Disney. And the thought at the time, it was kind of, some more West Coast parents who wanted to believe a little bit more in kind of all natural, safety, healthy, all those kind of things. And there was an outbreak at Disney then. In 2019, there was an outbreak in New York that was spurred by, honestly, small groups, small little pockets of unvaccinated, undervaccinated people, a lot of them citing religious reasons for avoiding vaccines. And there were over 1,000 cases of measles that year. Again, measles was supposed to be eradicated in the 60s or in the 70s and the 80s. This has been a moving target of when are we going to eradicate measles? It's been stated many times by the US government, and we clearly have still not hit it. So we talked about the history, and a brief overview of that, why it's important, some of the things go into that. So what are some of the things that we can do as providers to talk to patients? What are some of the things? Because there's no single magical bullet. There's some things that have shown to work a little bit and shown to have some good rates, but nothing's perfect. So I'm going to go over a couple of those now. This is a new one to me that I hadn't really thought a lot about because we spend a lot of time with shared decision-making and these things and, making sure to build this relationship. There's this idea of presumptive versus persuasive language. Basically the idea of, this is what you need today versus what do you think about this? I know that personally when I talk with patients with the flu shot, a lot of times I find myself asking, all right, what do you think about getting the flu shot? And it's kind of been shown that actually if you say, all right, you're due for the flu shot, let's go ahead and get that for you. Most people will just go along and say yes. And this is a little figure from American Academy of Pediatrics because they suggest this a lot. Basically assume that people are going to get vaccinated, and then if they have questions, address them, give your recommendation, and we can go over a couple of ways of kind of how to do that and how to frame that. There's a study looking at HPV vaccinations where they just, this is kind of a smaller study, but they just recorded conversations, didn't tell people what they're looking at, found that providers who use presumptive language, they had a vaccination rate around 73%, and providers who didn't had a vaccination rate around 21, 22%. So it's highly effective. Again, small studies, but it's been shown to work, and that's the reason why it's one of the recommendations. So you say, all right, you want to do this, but they say, I don't know about that. So really we could spend a long time up here talking about motivational interview techniques, using empathy. That should be your primary tool. An issue you run into is it takes a lot of time. And, in the pediatric version, an average well child visit is 18 minutes. And most providers report spending about 10 minutes talking with their patients about getting vaccines. So you miss out on a lot of other things. So how do you do this quickly? This is a little acronym that I found that's been shown to work sometimes of basically, how do you walk through this in kind of a quick way? You corroborate. Yeah, I agree that would sound scary. Like that, I understand why that would be concerning for you. Let me tell you a little bit about myself. This is where I did my training. This is the stuff that I've looked into, and this is what I've seen from people who have it. And this is what the science has shown to be true. And so this is what I think you should do. Corroborate, tell about yourself, talk about the science, and then explain what you think should happen. It shouldn't take too long. It's kind of just a way to kind of push empathy and motivational interviewing into a little bit smaller context. That way you can address a few things at the same time. This one comes up a lot. Patients will come in, oh no, I don't want to get this because I heard blah, blah, blah. And it's absolutely human instinct to just say, well, that's not right. There's no reason, that's not truth. That's not anything. Spend some time telling them why those beliefs are false. Multiple studies have shown this doesn't work, especially if you spend a long time refuting these myths. People just remember the myth, or you might get them where they don't believe the myth anymore. But studies have shown that people who are kind of on the fence end up being actually less likely, because sure, they don't believe that myth anymore, but those words are still bouncing around in their mind. So, looking at MMR, looking at flu, talking about, will you get the flu? No, you won't get the flu. Still, people said, okay, I won't get the flu. I still don't really want the vaccine, and actually decrease the rates of that. And so it's important to kind of address it very quickly and kind of move on, pivot basically to another issue, or just talk about, all right, yeah, that sounds scary, but this is why, I would get it. Another option, and this comes from some of the kind of psychological theories. There weren't a lot of studies showing that this works, but from human psychology idea, it makes some sense of basically people don't like to be viewed as being extreme on anything. And vaccination tends to promote an extreme response. It's yes, no, I'm pro-vaccine or I'm an anti-vaxxer. And we need to be able to give people the allowance to be somewhere in the middle while still pushing them towards, yes, I think you should get the vaccine. So instead of saying yes, no, you want to get vaccinated today? Do you want to schedule a visit for next week to get vaccinated? Or do you want to hold off for now? Do you want to get vaccinated today and we'll address this and this? Do you want to just get vaccinated today? Or do you want to come back next week and get vaccinated? People tend to like picking the middle options. They don't like being seen as extreme. And if they say no, not now, remember, every conversation is a step along the way. This is the stuff that we see with diabetes management. We talk about it over and over again with smoking and alcohol use. Just bringing it up every time you bring it up is another step along the way. A big thing not to forget about is how important we are as healthcare providers. This is a recent study, and we'll be pulling a lot of stuff from the Kaiser Foundation, because they do a lot of polling looking at vaccine ideas and personal theories. But the most cited reason for getting vaccinated is a recommendation from their provider, from their nurse, somebody that they trust, from a medical thing. And so you just saying, yes, I get my flu shot. I get my flu shot every year. When are we getting yours? That's the most commonly cited reason why people like to get there. So don't forget that you have a strong voice in this just by talking about yourself for a second. Okay. So again, pretty briefly and moving through things kind of fast, talked about the overview, talked about some specifics, definitions, and some communication strategies. I want to spend a while kind of diving into COVID, because that's one of the reasons why so much of this has blown up recently and why we're talking about it so much, because there's large percentages of the population that show this. Most of the data we're going to be looking at is US. I just wanted to address quickly that this is an issue. Every country is different. There's different populations everywhere, and it's not just our issue. This was in 2020 when our numbers were a little bit better, but it was, we're hanging out right here at that time, about 75% of the population was looking at, this was, I think, around May last year. And our numbers have moved all around since then. But they found basically countries who had stronger beliefs in government, had faith in their government, tended to rank a little bit higher, and places that had some more questions tended to rank lower. Places who had negative experiences with vaccination programs before tended to rank lower. France had issues with some reports about hepatitis B vaccine. Nigeria had an issue it was actually with the polio vaccine. There was a program there. There's a lot of pushback with concern about Western influence on it at the time, because it was right after 9/11, and there were a lot of questions at the time. And so there's all sorts of things that go into it. Again, we won't get into every single specific here. So we're going to be talking about us, the U.S. for the rest of the time, basically. Remembering that to reach this, I don't want to say mythical, but the herd immunity idea that we've been talking about, hitting that number, it's varied somewhat, 70, 80%. We have to get a lot of people vaccinated to get back to some version of normal life. The CDC just announced, okay, now if you're vaccinated, you can get together in small groups. That's a baby step along the way and some nice messaging, but we have a long way to go still. This was the data as of Monday, I think, was when I pulled this one. So it's showing that even the best states are around a quarter of their populations are vaccinated, and tends to be states with some smaller population. And because of the way that we've been pushing this, on the bright side, over half of people who are 75 and older have had at least one vaccine. That's great. This is a population we're trying to get to, absolutely. But to get back to life as normal, we need to hit all these populations. And, there's absolutely some considerations for this group under 18. If a quarter, I think it last study or last stat I saw said a quarter of the US population is under 18. How are we going to get there until we get to the point, that we need a lot more research and availability for how we're going to get it to pediatrics. This is the data just from Tennessee itself. And again, looking back at some of those C's that we're talking about and the convenience availability, Tennessee is given about 70% of their doses, which means they still have a good number of doses that are available to be given. It's the issue of distributing them properly, getting them to people. We've been lucky here, and I'll show the site later for the Hamilton County thing, but every place is different. Here, it's been pretty easy, to point people, get people to sign up. And usually there's openings in the next day or two, which means there's availability. It's just getting people to get there. So this is just looking at overall public attitude towards COVID vaccination. So, likelihood or looking at vaccination, a small percentage at that time, this was from back in January, was already vaccinated. There's this large population that were saying, I don't think so, I need some more time. We're not really talking about them. We're talking about these people in the middle. Extremely likely are probably just going to go ahead and get it. But there are a lot of people that we can pick up in this area if we figure out how to communicate, how to distribute, how to do all of these things. Another thing I wanted to address as well was talking about healthcare workers. This stat kind of surprised me. Looking at these things, obviously more healthcare workers have gotten the vaccine because we've been prioritized as being the people who are most at risk. But there's a lot of healthcare workers who still don't want to get the vaccine and have concerns about it. And it's very easy to feel like just dismissive, or all right, how many patients we have to see in the ICU with this? When are you just going to go get your vaccine? But people bring up some concerns that you can't just dismiss out of hand. And so it's important to talk to them about this and realize that we're not just talking about the general public, we're talking about ourselves as well. And a lot of this comes from, views of leadership and things like that. Interesting stats that they showed too, men were more likely to be already vaccinated. There was association with education, as well with income. Basically, if you're over 200,000, you were very likely to getting it or already get it. If you were less than 50,000, you were more like, it was 30-40% that were unlikely to get it. So there's some discrepancies in there. We have to look at people individually. Going back to the 3 C's again, back to convenience, because that keeps being this issue with the COVID vaccine, especially, this question of 2 shots versus 1 shot. And now that we have this new vaccine that's been approved, 1 shot should be easier to distribute. How much is this going to help? And we do see that, especially in this population that's this wait and see, kind of right in that middle of the delayed group, the vaccine hesitant group that we're talking about, that should give us some improvement. But there's also some considerations. There's some concern with how the 1-shot dose is going to be targeted. Is it going to be used for, potentially lower income or some underrepresented populations and viewed as a lesser vaccine because some of the numbers said, okay, it has less protection. But again, it, does just as well with hospitalization, death, the things that we really concern about, but some of the messaging has been a little bit questionable on it, and it's going to be interesting to see how that all goes. This was a study that I found that was kind of the end of last year, early this year, that was looking at how do we message the COVID vaccine and why it's important. We've talked about the importance of our voice as healthcare providers. We've talked about the things that we looked at, the things that people are interested in, that they're concerned about. And this looked at, kind of a lay average person versus a healthcare professional, whether you focus on a person's individual health or the overall public health and their effect on other people, or the economic response. If you spend some time doing, they called it pre-bunking in their thing, but it was basically addressing concerns before you hear them, especially with the COVID vaccine, with how quickly it came out. The most common question is this safe? They just started making this last year, and now all of a sudden we have it. How can it really be safe? We haven't seen the side effects, all those things. So if they address that going on, what sort of effects did that have? Unfortunately, long story short, is not a lot of things really worked that well. It seemed overall, looking at statistically significance, there were only a couple of them. There were general positive outcomes, especially when you focus on a patient's personal health. If you put their own health at stake, that they'll listen a little bit more to that message. There's a little bit more favorability towards hearing it from a healthcare expert, but people also liked hearing it from members of their community or something like that. Pre-bunking did not really help. Overall, it tended to do a little bit worse when they looked at everything, because again, it just reminded people, oh, right, this is something that came out very quickly. Maybe I need to wait and see. And the other thing to remember is that basically people are already likely to get it. A lot of these things didn't do anything on because they were already likely to get it. People who said, I don't want this, extremely unlikely, they also were not likely to be budged. And so we're looking at the people in the middle. Those were the people who tended to be able to be shifted a little bit, depending on how we frame the message and how we tell the story and all those kind of things. So what do we want to talk about, and what are patients concerned about with COVID? Again, we talked about it earlier. Things only work if people know that it's safe and effective. So that was the number one concern that people reported that would make them more likely to get vaccinated for COVID if it's more effective, or if it's effective, and if it'll help you protect you from getting sick. That's what that last study showed, was that people liked hearing that I personally will be healthier, I won't get sick if I get this vaccine, and I can go back to some sort of life. Interesting that a lot of these, there's something I kept coming up with, was that personal history of having COVID, or having a family member, having a friend who had COVID, I had a hard time finding any studies that showed that had any sort of influence or correlation with people wanting to get vaccinated. That was counterintuitive to me and what I kind of thought going into it. I thought that would make people more likely, but that's, again, showed here that it's less important than finding out that it's a free vaccine. So just some things to think about when we're talking about patients, talking with patients about this. And so again, hitting through this again of, what people were really concerned about. Side effects is the number one thing. And especially the important thing to see here is this is a population group that we're looking at, this wait and see. There are a lot of people who say, yeah, I'll get it if my job requires it. But the side effects is actually highest in this wait and see group. That's what they're really concerned about. They're absolutely, these concerns you hear with other vaccines of, will I get the actual virus? Will I get this? How difficult is it going to be to travel to a vaccination site was an issue. Like I said, it's doing pretty well here. My parents out in Oregon had to drive 2 hours to go get their vaccine, and had to go through multiple counties to be able to find it after calling every pharmacy every single day. That was their retirement activity basically for the last couple months, until they finally were able to find a spot in Albany that would do it. So just a little personal anecdote there. But again, the side effects are the main thing that people are concerned about, especially in this group. So it's figuring out how to talk about those and how to address it. Yes, this came up quickly, talk about your own experience with side effects when you got the vaccine. Mention that, yeah, we're still studying this, we're still following along with it. Another thing that kept popping up was basically where you get your information matters. And we'll kind of go in depth more on some of these things, but depending on where you get your information, that can change a lot of things, especially social media. There's some, and we'll talk about it in a second, but some of the concern about vaccination, it's very easy for word to spread. And, it's this idea, basically, a word gets out, it's hard to retract any of these things because things stick in people's mind. So there is an effect of where people get their information that absolutely matters for their likelihood to get vaccinated. I threw this up here just to kind of also look at the news source and, kind of depending on the framing that you're seeing, where you end up going and walking around the hospital, seeing what's on TV in a lot of the rooms. Maybe we change some TVs or something. But basically there is an influence on where you're getting your information, and it's been borne out in this was from January of this year, that it had at least some correlation there. You can absolutely say that people who are less likely to get it might be looking for those sites, or people who want to get it be looking for information from a different one. But I'm not saying causation, but there's absolutely a correlation there. Social media has a big influence in this as well. We all saw it when vaccines started rolling out here. Everybody was posting selfies of themselves saying, hey, I got the vaccine. And that was, ACP pushed this. I am vaccinated. I got the shot. I'm not going to miss my shot. Any of these kind of things to really try to encourage the public and say, hey, this is what we want you to get. And we are the ones who are getting it right now. We're showing you that we're getting it. There is power to that message. At the same time, it's easy for misinformation and concerns to spread. And especially Facebook is one that's been looked at a lot. There was a large study looked at 100 million users, but basically looking at these pockets of groups, and showed that anti-vaccination groups in general tended to be smaller, but they were much more centrally located in whatever magical computer hubs, versus the pro-vax messages, which were larger groups, but kind of land on the periphery. And the anti-vax groups used multimedia messaging, had all sorts of different messages they could show. Pro-vaccine groups basically said, hey, it's great, you should do it. and it's harder for that to spread and do well. And the anti-vax groups they were smaller, but they were more central, so they tended to have a little bit more outreach into these communities that were in this kind of undecided by, again, however they figure all this stuff out on the internet. So there's a concern there. And then just for a little break as well, there's also, as messaging is coming out, it's also coming out in pop culture as well. So this is a 1-minute video just to kind of talk, and this was from last week, I think.
Oh, this is great news. The FDA says Johnson & Johnson's one-shot vaccine is safe and effective. Only one shot. They actually released an official statement explaining their vaccine. They said, meanwhile, Moderna and Pfizer are jealous because their vaccines take 2 shots. So they released a statement that said, but people don't really care which shot they get as long as it works. They're just like, so Moderna, Pfizer, and Johnson & Johnson put their differences aside to release this statement.
So like that was a little clip that honestly I saw on Instagram the other day because it was just making its rounds on there and people were reposting that and retweeting that. And so, there are ways to get messages out this way, but it's, that's an entertaining way to get it out and, talk about it in a way, but it can be hard sometimes to just get out this message of, hey, you should go get vaccinated. And, kind of addressing the thing that we've absolutely seen much more so in this specific pandemic than in previous things is there is partisan polarization. And, if you looked at this data, this is just looking from December till now, looking, kind of at the different political parties. But if you pull this back further, you go to May of last year, 75% of all people said, yes, I want to get the vaccination. And as it went along, those numbers started dipping and it got closer to the election. And actually the Republican numbers went up, and it was a lot of it kind of the rhetoric of, right, we're going to get a vaccine. It's going to be before the election, let's go. And those numbers started jumping up, and there were concerns on the other side of, is this safe? And, when you have, a political leader on one side saying we're going to get it, and political leader on the other side saying, I'm not going to trust it if he's the one who's telling us, we end up with these issues. And, now that we've have new leaders and all those things, we've now seen how that can affect it. So that's kind of where we are, but also looking at, especially these wait and see is kind of what we're looking at, that these wait and sees tend to be going down, but overall, it seems to be that more people who are going wait and see are tending towards, all right, I'm actually going to go get it, which is good. But, we still have a large number who haven't really budged on that. And remember back when I was talking at first about vaccine hesitant and who these patients are and what it is. A single person is not just one of these things. They encompass 3, 4, 5, like a multiple of these groups. So, you can say, sure, an older Democrat who lives in a household with, a sick member would be considered much more likely to get it, opposed to, potentially some of the people in our backyard here. We're in Tennessee, a Republican, younger, rural. That's a lot of our patients in our kind of surrounding area around here. So understanding how to kind of communicate with them and recognize them for their own personal beliefs, individuality, and try to figure out what to do there. So just remember, there's a lot of things that go into each person's thing. We can't just divvy it up by one thing. So how do we, and another question that comes up is kind of earning the public trust. We saw this especially early, and it's continued on where there are certain populations that have been affected, more or worse by the COVID pandemic. And there's also a lot of report of lack of trust in some of these government bodies that we have a lot of faith in, FDA, CDC. This was studies showing that basically only 1/3 of respondents had faith in those organizations, that they were getting the truth, the most up-to-date information, that they weren't trying to be coerced. But again, going back to what I said earlier, our voices matter. 2/3 of people still had confidence in the provider's advice. And so one of the ideas going forward is to try to prioritize sharing stories of some of these underrepresented populations being vaccinated. When the vaccine first came, or first people who were vaccinated in America, there were a lot of kind of individual stories about who these people are, why are they getting vaccinated, what was their reason for doing it, to talk about it. I would encourage you guys to go just check this out. It's about a 5-minute video. I'm not going to pull it up now and show it and everything, but basically it's, it's one of those ways of trying to reach out to communities that might be underrepresented. This was W. Kamau Bell and meeting with 10, 12 different African-American healthcare providers in various roles across the country, asking them some of the questions. And if you watch this, it takes 5 minutes. They hit on a lot of the strategies that we've been talking about and will talk about. And they hit on some of those 3 C's and those things, trying to get the message out and support it. So I'd recommend you guys check this out whenever you get a chance. Issue we've run into as well, especially with that release of the vaccine, is supply and demand. And again, keep going back to those 3 C's, the convenience. How can I go get it? And we saw this across the country. You know, Mass General, when they released it to their hospital system, report was 50,000 people all tried to log in at the same time and broke the system. Geisinger Health Systems, they started trying to schedule it very early. And so they had an implemented way where everybody was scheduled and they staggered things within departments. And then, you know, we saw what it was like here. You know, I was somebody with the last name S. So I was scheduled to go for my first dose at 8 a.m. on the first day. A lot of people showed up on that day and they were a little bit overwhelmed by the experience. But then when I showed up for the second dose, you know, I had a scheduled time. I was in and out in 15 minutes. It was a breeze. So it's figuring out how to get these out effectively to people. And there are a lot of people, you know, that's for us as healthcare providers, but there are a lot of people in the community who don't know how to get the vaccine. You know, speaking with my father-in-law, who was trying to figure out how to get his vaccine up in Pennsylvania. You know, speaking to my parents, going through all of their things, trying to communicate with different things. And part of the issue is with every individual community working with themselves and kind of the brunt being put on them, it makes it a little bit better for messaging sake of like, all right, these are people who I trust who are doing it, but it also makes it harder to encourage somebody who might not live in your community to even tell them what their resources are, besides saying, go to your county health website and take a look. I just threw up the Hamilton County website on there as well, because it is good. From everything I've seen, it's effective. It's easy to take a look and see when you can get vaccines and where you can get them and sign up pretty easily. I've had some luck, you know, suggesting that to patients, and honestly, especially for our crew over at Dodson, I'd probably recommend just putting that like in your AVS of just like, hey, go to this website and sign up if you want to, especially now they're in the 1C and a lot of our patients now are eligible. So this just is a little bit more data talking about that concern for knowledge. Basically, most people, you know, do not feel like they have enough information about when they're going to be able to get it. You know, we talk through these, you know, 1A, 1B, 1C, 2, 3, all these things, and they make some sense to us, but I get confused by it, and I'm theoretically in this system and understand these things. And so trying to kind of communicate, all right, this is when it's going to be your time, it can be difficult. And it's easy to post out, you know, FAQs, vaccine facts, all these things, but we really need some more specific messaging to individual communities and resources about where they can go and ways to sign up for, hey, just put here, we'll send you a text when it's your time. So that way you don't have to worry about it and offload some of the stuff from them. Would all be ideas moving forward. And a lot of this also requires regional coordination. Like I mentioned, especially with the way that the COVID vaccine is being rolled out, it is on individual communities, individual counties, individual states to use their vaccines that they're given as they see fit and try to get them out to as many population or people as they can. And so there's, you know, thoughts about how to do this. There was talk, I remember at the Super Bowl, I think Goodell mentioned that they were going to start using NFL stadiums for vaccine. I don't know if that's happened in some places. You know, here they've done it in different areas. They use the bus station over by the choo-choo. You know, they have some larger areas where you can just kind of drive there and get it, but trying to figure out ways where people can get it easily. And again, going back to streamlining communications, not only to patients, but also within ourselves, you know, making sure that, you know, the healthcare systems work with each other, that PCPs are updated, especially if somebody, you know, gets a new diagnosis or something where they would qualify or something would change. And that way just we can keep better track of it. So that way we're being responsible with our patients. I talked about a lot of things about potential overviews. This was just kind of an easy way to look at sort of where people land and some ways to talk to them. You know, if people want to get it, all we really got to do, you know, we're talking about those 3 C's. They're already confident in it. They're not complacent. So we just got to hit the convenience. So we got to make sure they're able to get it. If they're not sure, you know, we might need to work a little bit on either the confidence or the complacency, figure out, you know, encourage about why you need to do it, you know, act now mentality of, hey, we only have so many, like really, we got to get going on this, or some sort of incentive, some reason why they need to go do it and take it out of their way. If somebody's leaning towards no, it takes a little bit more work, but can still, theoretically be done. And, that's then relying on not only us as healthcare providers, but community advocates. Some places have kind of trained people to be community advocates for their area and reaching out beyond the healthcare system, reaching out to local organizations, schools, churches, what have you, to see about just kind of getting the message out a little bit more, figure out ways to what the personal identity hurdles are that people need to get through and how to move forward past them. And then people who are saying, absolutely not, I'm not going to get it. The biggest thing to do to make sure is don't push them further into that box. Don't shame them. Don't patronize them. Don't talk down to them. Don't say, well, I think you're being foolish. Avoid all of those things, because that's just going to push them farther that way. There has to be open communication and transparency and, acknowledging, yeah, I understand why you have concerns. I had some concerns. This is why I went and got mine. But you need kind of all of these things, and it's going to take a lot of work. And like I said, there's no magic bullet to kind of get this stuff done. It's just a website I would recommend for all of y'all to go just take a look at, especially with some of the concern that a lot of the public has had with about CDC, FDA, some of the sites that we use for, communication and all these things. Immunize.org has tons of information, vaccine specific. They have patient handouts. They have quick little PowerPoints that you can review to answer your most commonly asked questions and have some kind of, short canned answers. They're kind of ready to go for some of these things that patients might bring up as concerns that they have, vaccine schedules. And there are places where you can, they have patient side things where you can send them that way so they can take a look and do some research on their own from a place that has a little bit more trust and everything. All right, so it's kind of a whirlwind 45 minutes. So just to kind of look over it again. So vaccine hesitancy is not a new issue. Since vaccines have been around, vaccine hesitancy has been around, vaccine resistance has been around. And understand this isn't a single population. This is a heterogeneous group. It encompasses all sorts of small pockets of people who have individual identities, and that contribute to that. So we have to work on understanding those, because that's really the only way that we're really ever going to affect change. Communication strategies have been shown to be effective. And a lot of these things don't have tons of study behind them, but they're promising things and they make some sense. Empathy is great, and use that all the time. That should be your number one weapon. Presumptive language might be something that you can do that could be a practice changing thing for you, of just, this is how you talk to patients about these things and see how it works, and just kind of, feel that out for yourself. That's something that, you can do as a thing. We're talking about things that, large organizations have to do. This is a step that you can take. And then remember, when we're having these conversations, try to avoid deep diving on these myths and correcting myths and fighting patients and telling them that they're wrong doing these things, because you're just pushing them farther towards that belief. So acknowledge it, address it, move on, pivot. And especially with everything going on right now, the number one thing is honesty and transparency. There is a reason why our patients have our trust in us and faith in us, and it's for that reason. So, they're only going to continue trusting as long as we continue to be honest and transparent. That's what I got. Any questions? Yeah.
First of all, this is really good.
Thanks.
Really interesting. I know in the COVID vaccine statistics for healthcare providers, that men are more likely to get it than women, or there's a little higher rate. Did they go into that at all?
So yeah, they didn't go ahead and try to. At least, so a lot of those stats where I looked at the public perception, a lot of those were within the Kaiser Foundation. They have this COVID vaccine dashboard, which they kind of, been polling people over and over again and kind of breaking things up into different stats. You could absolutely consider that, it's a question of maybe what different populations. If you look at some of the other issues, you also saw that along with income, there was also a difference on, education level, on race, on whatever it is. So understanding that they're speaking not just with physicians there, they're speaking with all healthcare workers. So I don't know offhand the stats of, I know that, there's absolutely a question of gender equality in kind of positions of power and where we are and all that stuff. So I don't know if it has anything to do with that, but it was something that they found there.
Go ahead. I had a quick question
Yeah.
about the Johnson & Johnson vaccine.
Yeah.
And if there's any hesitancy associated with it, since most healthcare providers were vaccinated with Moderna and Pfizer.
Yeah, so right now, at least I couldn't find any data about, public perception of specifically that one, because again, everything is just coming out. And I'm sure in like a couple weeks, we'll take a look at that. And if I see something, I'll send it out to the residents and just kind of like, hey, this is what now the concern is. I was speaking with Dr. McCart earlier, and he was mentioning that, people would come to him with some concerns of, is this the safe vaccine to get? I went here to get this one, and instead they told me I'm going to get the Johnson & Johnson. I feel like I'm not being, told. And then one of the concerns that is brought up is, hey, if it's, considered to be the slightly less effective one or something, because that's a lot of the public perception right now, because the first stats that came out were these other ones are, 96, 95, whatever percent. Oh, Johnson & Johnson 70. And then, there are a lot of things, infographics and stuff that have shown actually the things we care about, hospitalization, deaths, they're all even. It's all great. But when you hear that, it's 70% effective versus 90 something, and it's easier to give, what population is that going to be targeted towards is absolutely a question that is worth addressing at some point. Yeah.
Do we have any idea when our clinic, UMA, or even the CVS there will be like able to administer the vaccine? Because I feel like we have a lot more, like the success rate will be able to provide right there instead of giving this.
It would be great. Like, especially, there's that little drive-through area right there where people go through. It would be amazing if they could, figure out how to do that. But again, there's, it's coordinating with so many people to get these things done. And, on the bright side, Hamilton at least has done a good job of, having availability and all that stuff. Granted, a lot of it requires access to a computer, access to internet, and there is some concern there of kind of what patient population. So even if it's something where in clinic, all right, it's going to take a couple more minutes, but just sitting there and walking them through it, if they say they're interested, I don't know how to, we have computers there. They can access the Hamilton County thing and get them there. So it'd be a thought, but yeah, obviously having the vaccine wherever we could, bring it to the patient so they don't have to go out, goes back again to that convenience idea and making it as easy as for them as they can. So that way they're incentivized to go do it.
Hey, Riley, can you hear us on here?
I think it's interesting. I think your point about transparency is very important. There are adverse effects for vaccines.
Yeah.
And I read a case report in one of the journals. There are people who are anti-vaxxers and they feel like there's an autism connection. There are actually very, very rare genetic variants that when you get a fever, it causes neurological changes. So there are people who get, young children who get a vaccine, they get a fever, and that's what causes. Now, they would have gotten a fever eventually sometime in their life, but I think being truthful to the patients is important. Where I've been somewhat successful is I actually pull up the data on I'll pull up New England Journal, I'll pull up and I'll say, look, this is the data, it's spectacular.
Yeah.
I suspect there will be some J&J hesitancy because it's a live virus, it's an adenovirus. And so I think that's going to cause some issues. But and then also there's a whole thing with the Catholic Church about using the stem cells from aborted fetuses and causing some medical issues. The Bishop of Knoxville, we're in the Diocese of Knoxville, not that there are many Catholics here, but said if you can't get another one, then you can take this one. But that'll also add something for you to know about. There's some religious overtones as well.
Yeah, absolutely.
Really, really good job.
Thank you. Any questions from online people?
Can you hear us, Charlie?
No idea if I'd be able to hear them if there were. Okay.
Hey, can you?
Thank you guys very much.
Really? My family is like, they're like, they like the, so they just like open it up and anyone who's not an older. And so they just like literally have a like calling pharmacies, like,
Hey, what's up, boss?
I'm sure you're having fun.
Just a blast.
And everything.
Yeah.
I had thrown on there just requested to like see about being able to do like dialysis clinic or nephrology or anything like that.
Yeah.
I wondered if that was even possible.
I'd imagine so. Honestly, so just to let you know.
Because I had like talked with Cool and Coco about it, and they were all about
Yeah,
it.
exactly. I was gonna say I can't imagine because I know that Coco always likes when people go to those kind of clinics. It's just like getting them there and everything.
Yeah.
So I just got to touch base with them and see with everything that has gone on recently. I was hoping to have the schedule. Honestly, I was hoping to have the schedule out to y'all by now, and then hopefully I got COVID and all that stuff. So yeah,
I mean, I
yeah.
think you're good. Yeah.
So basically right now, all of the required, all that stuff is set. It's just like the electives, figuring out where to come in and all those things. But yeah, I'll reach out to them and see kind of when it comes to them. If they have any specific requests, otherwise, yeah. Yeah. You're on B, right?
Yeah.
Okay, cool. Yeah, I'm with you next week. So.
Oh, really?
Yeah.
Because I figured we've got Youngblood and Lacard both on right now for
Yeah.
C and B.
Okay, yeah,
So-
yeah. Some trade for Carrie. I think she's on vacation next week. So.
Okay. Well, good. I'm excited. It'll
Yeah.
be you, me, and Santi.
Yeah, that should be a good team. I'm just gonna hang out at home. You guys can just call me.